How can you identify your tinnitus subtype and create a tailored treatment plan for maximum relief from the noise? It's key to remember that tinnitus sufferers are not a uniform group and that tinnitus is not a single problem with one universally effective treatment approach. Because the experience of intrusive tinnitus is intertwined with several different neural networks in your nervous system, coexisting health conditions that also interact with these neural networks can serve as tinnitus drivers without you even realizing the connection. So I think it's very helpful to define several distinct tinnitus subtypes based on these various tinnitus drivers because the optimal treatment approach for each differs. Identifying and addressing these coexisting health conditions that are perpetuating your tinnitus is an essential part of a comprehensive, multifaceted tinnitus treatment program. Now, we could talk for hours about this subject, but today in this video, I want to give you a taste of what supplemental individualized treatment modalities can be helpful based on your tinnitus subtype. So, if you're a person with somatosensory tinnitus, you've likely observed that you can modulate the character or severity of your tinnitus by moving or pressing on your neck, jaw, or face. Most people with this subtype of tinnitus have some underlying issues with their jaw joints or cervical spine, or they may have abnormal muscle tension in the chewing or neck muscles. You might also observe tightness or tenderness when you touch your chewing muscles here, or your neck muscles here or here. So, if you are a person that fits within this category, there are several supplemental treatment modalities supported by clinical research that have great potential to reduce your tinnitus. Now, the choice may vary based on the location of your individual problem in this area, but options include things like physical therapy, manual therapy, and even tailored appliances that fit between your teeth. Specialists that may be able to help determine which of these treatments will be most effective for you include a physical medicine physician, a physical therapist, and a TMD specialist dentist. Another common subtype is tinnitus associated with anxiety or depression. And when I talk about this link, I want to make sure to communicate that if you have tinnitus in the setting of a mental health condition like anxiety or depression, it does not make it any less real. It doesn't mean it's all in your head, as people say. It doesn't mean that you're crazy or that you're making it up. Mental health conditions, just like tinnitus, occur because of changes in our neurobiology, and they are just as real as any physical malady. But there is a robust interplay between tinnitus, anxiety, and depression. And if we fail to identify the role that anxiety or depression is playing in the tinnitus experience, it's much harder to achieve meaningful improvements in tinnitus with the tools that we have. So, first of all, how can we determine if you, as a tinnitus sufferer, fit within this subtype? Well, most of the time, people in this group have some awareness of this possibility based on the moods and emotions that they are experiencing. However, this is not always the case. A formal assessment is best conducted by a mental health professional. But there are a couple of widely available survey tools that can be used to screen yourself. The questionnaires that I have used in my practice are the GAD-7, that's GAD-7 for anxiety, and the PHQ-9 for depression. And you can find either one of these with a simple Google search. In my practice, I would refer any of my patients with intrusive tinnitus scoring 8 or above on either of these questionnaires to a mental health professional for additional assessment. For those of you fitting within this subtype, Clinical research indicates that treatments for anxiety or depression, including cognitive behavioral therapy, healthy diet and lifestyle changes, and certain medications, can significantly improve the burden of your tinnitus. The next subtype we'll discuss is tinnitus associated with atypical migraine. And this one is surprising to a lot of people because they think of migraine as a headache condition. But a more modern understanding of migraine is that it is a sensory processing disorder and that headache is just one possible symptom. In my otolaryngology practice, I would see patients every day in my clinic with non-headache symptoms of atypical migraine, like episodic vertigo, unexplained ear fullness, sound sensitivity, sinus or facial pressure, auditory changes, and fluctuating tinnitus. Unfortunately, there is no definitive diagnostic test for migraine, but the most suggestive clue that a person's tinnitus may be influenced by migraine is if they report that their tinnitus fluctuates significantly over the course of a typical week. Frequently, people with this subtype will report spikes in their tinnitus due to factors like stress, sleep deprivation, hormonal changes, certain foods, missed meals, and shifts in weather or barometric pressure. Many will report a family history of migraine or even a personal history of having migraine headaches when they were younger that seemed to resolve. If you think that you may fit within this subtype, migraine-specific therapies have great potential to improve your tinnitus. And these treatment options fall within three main categories: migraine trigger avoidance strategies, nutritional supplements, and migraine prophylactic medications. I'll put links below to some resources with more information on this, including an article I wrote on this topic for Tinnitus Today magazine. The fourth subtype I'd like to mention is tinnitus in the setting of a sleep disorder. Multiple studies have documented that around 60 to 70% of tinnitus sufferers report sleep problems, and that greater sleep difficulties are correlated with increased tinnitus severity. For many, there seems to be a vicious cycle in which tinnitus interferes with sleep, and the more sleep deprived they become, the louder and more intrusive they find their tinnitus. So, for those that fit within this subtype, clinical research has shown that treatments aimed specifically at improving sleep can produce meaningful improvements in tinnitus as well. And the interventions that tend to be the most helpful include education about sleep hygiene practices, a special form of cognitive behavioral therapy focused on sleep, and, if necessary, medications. So, as a tinnitus sufferer, if you find yourself with significant sleep difficulties, please discuss treatment options with your primary care physician. Now, some of you may watch this video and conclude that you don't fit any of the four subtypes that we discussed today, and that's okay. Effective treatments exist for you as well. These are just among the four most common subtypes that I have encountered in my practice. So, the main takeaway is that finding relief from tinnitus is not about searching for that one magic treatment that works for everyone. It's about developing a better understanding of your particular pattern of tinnitus. It's also important to remember that these subtypes aren't mutually exclusive. Many tinnitus sufferers will recognize themselves in more than one of these patterns, and if that's you, please don't feel like you need to choose just one. Addressing each contributing driver rather than focusing on only one is often what separates partial relief from real lasting improvement. Tinnitus, I know, can feel like an isolating, frustrating, and sometimes hopeless experience, especially when you've been told over and over again that there's nothing that can be done. But I want you to walk away from this video with a different message. Effective tinnitus treatments supported by clinical research exist, And one of the first steps in a comprehensive, multifaceted treatment approach is to identify your specific subtype or subtypes so that a more individualized treatment strategy can be delivered. So, was this helpful for you? Do you want more of this so that you can start making significant progress with your tinnitus? Well, I've put together a free workshop where you'll discover the same neurological rewiring based model that I've used to help over 1,000 tinnitus patients find quiet. It works by creating optimal bodily conditions for the brain to reclassify the tinnitus as unimportant and non threatening. And when that happens, the noise can fade into the background of your awareness and stop bothering you. Before you know it, you'll have some of the best tinnitus tools that modern science has to offer, many of which the average ENT or audiologist hasn't been trained about. If managing this issue alone hasn't delivered the relief that you were hoping for and the sound is starting to take its toll, maybe it's time to take things into your own hands. Again, there's no cost here, so click the button below to watch the workshop now and equip yourself with the tools to help you find better and quieter days ahead.